Hi, good morning. I'm Dr. Major Chandra Prakash. I'm a maxillofacial surgeon. My colleague, Dr. Chetna. Today we are demonstrating a case of chronic TMJ dislocation from last few years. Patient is having a problem that there is a chronic dislocation of the joint and it gets stuck in that particular area. It becomes an emergency for him. So we are doing a non-surgical management of dislocated joint. This dislocation of the joint, where we are giving an intra-articular injection of injectable platelet-rich factor, that is an IPRF. Previously, people used to give an autologous blood, but now the PRF is more safer as compared to the autologous blood we are giving in this case. So let me particularly demonstrate the anatomical landmark for giving an auriculotemporal nerve block along with intra-articular injection in the TMJ bilaterally joint for making the joint movements a little restricted. The idea behind this injection is that we are giving an injection in the intra-articular joint space where we are restricting the movement by creating some kind of fibrosis. Because of this injection, there will be a little inflammatory reaction inside the temporomandibular joint and it leads to fibrosis. And with that fibrosis, there will be a little restriction movement in relation to bilateral temporomandibular joint. Let me practically demonstrate the anatomical landmarks. So let me give you some anatomical landmarks for this intra-articular injection. The lateral part of the orbit, where the lateral canthal attachment is there, vitreous tubercle, you can feel it on the lateral part of the orbit. There is a vitreous tubercle. From that, you can make a straight line to the mid-tragus. And this is a straight line from the lateral part of the orbit, the vitreous tubercle attachment, from there till mid-tragus, and over this line, just 0.5 centimeters ahead of the mid-tragus. This is 0.5 centimeter mid-tragus. Then you can give a tangent line at least 1.5 centimeter down. And you can ask the patient to open the mouth, मुंह खोलिए आप. You can feel a depression here, and this is the point where we are going to give a auriculotemporal nerve injections. At least 0.5 centimeter oblique and superior to this location is an auriculotemporal nerve where we'll block the nerve. Then from mid-tragus, at least 1 centimeter ahead on this canthomedial line, at least 2 millimeter tangent, 1 centimeter here and 2 millimeter down. Open your mouth, मुंह खोलिए जी, मुंह खोलिए. This is the point where we are going to give an intra-articular injection. Once patient asked to open the mouth, we found that this is a superior joint space. We are going to give an injection in this location. At least 1.5 to 1.8 ml can be injected in this superior joint space. Always ask the patient to open the mouth wide open. You can have some bite inside so that patient cannot close. While giving an injection, you make sure that the mouth is open so that the injection will be given in the superior joint space. The patient should not close the mouth, otherwise you may break the needle inside. So ask the patient to open the mouth, and then you can give it at least 1 to 1.5 ml of hydrocortisone or sodium decals or any kind of sclerosing agent, or in this case we are giving PRF, and reason is to create a fibrosis in the joint. First we'll give an auriculotemporal nerve block, and then we'll give a intra-articular injection, and then we'll ask the patient to close the mouth. Move kijiye. And now I could make out there is a depression at least 0.5 centimeter here, at least 0.5 centimeter in the same line like here, 0.5 centimeter, aspirate it and inject. I have injected only 0.5 ml of local anesthesia. Just keep it a little pressed. Although the same, in case if you don't want to give an auriculotemporal nerve block, you can have a local anesthesia mixed with IPRF and you can directly inject here. But it is always better to give a auriculotemporal nerve block. Can you give me an IPRF please now? Approximately 1 ml. I'm going to inject in the upper joint space. So we'll just keep it here at least 0.5 centimeter, sorry, and then aspirate. And then mind you that there should not be any kind of resistance in the upper joint space while injecting this in the TM joint space. We don't want any kind of resistance, and it should go very smoothly inside. Although you can go for 1.5, 1.8 ml maximum, but I am injected 1 ml. .5 centimeter aspiration. Straight, go in a joint, no resistance at all. It should go smoothly. Keep the patient's mouth open. Always put a bite intraocclusal so that patient will not bite while doing an injection, otherwise it may break the needle. Go slowly, inject it at least 1 ml without any resistance. ये ऐसे एक्सरसाइज करनी है, ठीक है? थोड़ा सा आज और कल 2-3 दिन दर्द रह सकता है जॉइंट में, ठीक है? इनमें जहां हमने इंजेक्शन दिया है 5 दिन रह सकता है, घबराना नहीं है इसके लिए, ठीक है? दवाई दे रहे हैं ना आपको? So hi guys, you have already seen the demarcated line as well as the clinical landmarks, how to go for auriculotemporal nerve block along with the intra-articular injections of bilateral TMJ for the chronic subluxation of the dislocation of the joint. So me, Dr. Prakash and Dr. Chetna, as you know, we will keep on giving a lot of videos of learning in relation to the oral surgery and MaxFX. Creative oral surgery. Please like our channel, please subscribe it, and do let us know in case if you want to know something good.